Good morning, everyone. There are many structures who provide stability. हमारे पैरों को, हमारे हिप जॉइंट को स्टेबल बनाने के लिए बहुत सारी रस्सियां, बहुत सारे टेंडन्स, बहुत सारे लिगामेंट्स मौजूद हैं। तो कैसे हमारा हिप जॉइंट स्टेबल रहता है? लाइक समवन वांट टू प्ले द फुटबॉल, किसी को फुटबॉल खेलना, ही वांट टू किक द फुटबॉल, देन द पर्सन वांट टू किक द फुटबॉल, ही नीड स्ट्रांग फोर्स। हु विल स्टेबल? कैसे स्टेबल रहेगा हिप? So for that purpose, we are having very special ligaments. हमारे अंदर, हमारे हिप जॉइंट के आसपास लिगामेंट्स पाए जाते हैं। लिगामेंट्स, what are the ligaments? Ligaments means the ligament who attaching one bone with another bone. There are two bones and ligaments are doing strong attachment. लिगामेंट्स का काम है दो बोन के बीच में एक स्ट्रॉन्ग स्टेबिलिटी बनाकर रखना। So ligaments play very important role from everywhere, from one place to another place. There are too many ligaments are located. This is the list of ligament. Ligament of the hip joint. 1, 2, 3, 4, 5. There are many other ligaments, but these are the very important ligaments who are responsible to provide the stability. जो स्टेबिलिटी प्रोवाइड करने के लिए जिम्मेदार हैं while performing the various movement. Like इलियोफीमोरल। चलिए पहले मैं आपको बता देता हूं व्हाट इज इलियोफीमोरल, व्हाट इज पिवोफीमोरल, इशियोफीमोरल, लिगामेंटम टेरस एंड एसिटाबुलैब्रम। बहुत इंपॉर्टेंट है। ओके, सो दिस इज द हिप जॉइंट, दिस इज द हिप बोन। ये हमारी हिप बोन है। So there are two hip bone. They are like this. They are like this, okay? One hip bone on this side, one hip bone on this side, and they are like this here. So uppermost bone, hip bone is made by three bones. Uppermost bone is called ilium. इसे हम इलियम कहते हैं। Okay, and then I am sitting like this. मैं ऐसे बैठ गया, देखिए। So my hip bone is sitting like this. A hip bone is, I am sitting on the hip bone. So when I am sitting on the hip bone, this part is touching the floor. ये part floor को touch करता है. So this is called ischium bone. Ischium. Ilium, ischium. And the front part, that is called pubis. ये आगे का जो भाग है इसे हम pubis कहते हैं। इसको ये pubic bone है। So ilium means uppermost, ischium means lowermost, pubis। और ये खड्डा देख रहे हैं, इसका नाम है ऑब्टूरेटर फोरामेन। इसी में आके हिप जॉइंट जुड़ेगा ऐसे। do the obturator foramen, then it will do the various movement. Up, down, like flex, extend, abduct, adduct, rotation, medial rotation, lateral rotation. There are lots of movement happening within this. So suppose if it will fall down, then suppose it is doing movement like this. It is falling down. Then what will happen? So one ligament are attaching from here to here. So there is a one ligament who is coming from here, from the tip of the head of femur. हमारे ये हेड ऑफ फीमर के टिप से निकल कर आता है और एक खड्डे में जाके जम जाता है. Now, but we are kicking the football discount. We are doing lots of movement. We are jumping, but hip is not coming out. Hip is not coming out. It always there because of the ligament, and the name of this ligament is ligamentum teres. हम जानते हैं teres. Teres means roof. So this is the ligamentum teres. Okay. Now, when we are doing various movement, one ligament coming to the ilium bone and attaching with this. One ligament coming from the ilium bone. एक तो लिगामेंट है जो इलियम बोन से आता है और फीमर में अटैच होता है. The another ligament coming from the ischium bone and attaching with the femur, and one ligament coming from the pubic bone and attaching with the femur. So now all the three bones are having strong attachment with this femur bone. So there are four ligaments, like one ligament here and three ligaments. The three ligaments coming from three bone, one from ilium, one from ischium, one from pubis. So four ligaments. So the ligament coming from the ilium and coming to the femur called iliofemoral ligament. The ligament coming from the ischium and attaching with the femur called ischiofemoral ligament. Ischiofemoral. The ligament coming from the pubis, जो pubis से आता है, and attaching with the femur called pubofemoral ligament. Iliofemoral, ischiofemoral, pubofemoral, and here is the ligamentum teres. एक और स्ट्रक्चर होता है जिसे कहते हैं हम लेवरम. ये भी स्टेबिलिटी देता है. फॉर एग्जाम्पल, you know that suppose this is the bottle. In the bottle, okay, right now bottle, in the bottle, sometimes we are putting some extra cover here. In many bottle we can see. जैसे हम नल भी फिट करते हैं ना, या कुछ हम चलो हमने एक रबर का यहाँ पर एक एक्स्ट्रा पैड लगा दिया, like we are putting the extra rubber pad, then we are doing the tightening of this, that rubber pad also providing stability. So what is happening? So this is the joint. ये हमारा हिप जॉइंट है. In the hip joint, there is one rubber pad here, ढक्कन. So we can tighten this. So when you are putting it, it also giving stability. Hip want to come out, it will not allow to come out. So that is called labrum. Labrum. Labrum means labia. Labia means lips. Okay, so it is also like a lips. Labrum. So there are mainly five structure. Acetabulum. This the name of this cavity. There are two cavity here. Acetabulum cavity and one foramen here. That is called obturator foramen. इसका नाम गलत बोला था क्या थोड़ी देर पहले? I didn't remember. Maybe I told this as a obturator foramen. So correct it. If I told this is the obturator foramen. इसका नाम है obturator foramen. So we can see. So if we see both the hip joint, we can see two eyes. That is obturator foramen. This is the acetabulum, where hip joint is fixing. And here there are lots of good blood supply. Okay, ligaments. Number one, ligamentum teres, coming from the tip of the head and attaching with the acetabulum. Then one is labrum, like a lips, like a rubber band, like a rubber pad, who is also not allowing the hip dislocation. That is acetabulum labrum. Then the three ligaments, iliofemoral, ischiofemoral, and the pivofemoral, three ligaments. One ligament coming from the backside, ischiofemoral on the backside, and other two ligament coming from the front side, iliofemoral and pivofemoral. Pubic bone आगे तो आगे से ही आएगा, ischium bone थोड़ा पीछे से आएगा ये. So in this way, the ligaments provide stability. Okay, and we will perform the various movement, and we'll see how the wonderful stability is there. So let's see in this image. So look at in this image. It's written iliofemoral, then pivofemoral, ischiofemoral, ligamentum teres and acetabulum labrum. ये पांच लिगामेंट हैं जिन्हें हम हिप के लिगामेंट कहते हैं. So ligaments are the structure who provide stability. वो stability provide करने का काम करते हैं. Look at here. All the five ligament: iliofemoral ligament, pivofemoral ligament, ischiofemoral ligament, ligamentum who is on the head. Okay, there are many ligaments. Even there are more ligaments other than this. इसके अलावा भी होते हैं, लेकिन ये मुख्य हैं. So when the ligaments are weaker, जब ये लिगामेंट कमजोर हो जाते हैं, तो फिर स्ट्रक्चर हम बदल जाता है, हमारा स्ट्रक्चर बदल जाता है. Then our structure is changing. Got it? So in this way, ligaments play very much important role. बहुत ही important role play करते हैं. Okay. So I will show you in this image also. So we can see in this image we are doing the flexion of hip. हम hip का flexion कर रहे हैं. So now we can see when we are doing the flexion of hip, can you see how your femur bone rotate going forward? You can see the movement of your femur bone. Okay. So now there is a ligament here. We already have discussed. I am looking from the back side. हम पीछे से देख रहे हैं. Now we can see here. This is your hip area. ये आपका hip area है. Can you see this? So this is the upper bone, ilium bone. This is the lower bone, ischium bone, and this is the inner bone, pubic bone. So one pubic bone connect with the other side of the pubic bone. एक pubic bone हमारे दूसरे side की pubic bone से attached रहती है. And there is also one ligament in between. इनके बीच में भी एक ligament होता है जिसे हम pubic symphysis कहते हैं. We can see here. This is. ये जब during the delivery it is softening. ये थोड़ा सा ढीला हो जाता है डिलीवरी के समय. Only in the female. So now when the person is doing various movement, so I told you the ligament who attached ilium to femur bone called iliofemoral. Iliofemoral in the front side. The ligament who connect with the pubic bone with the femur called pubofemoral. It is also in the front side. ये भी आगे है. But if we go on the back side, ये तो हम if we are going on the back side, अगर हम पीछे की ओर जाएं, so from the ischium bone there is a ligament. From the ischium bone there is a ligament who attach with the femur bone, that is called ischiofemoral. Okay, now the ligament who is attaching the femur bone, now look at here. So one ligament who is coming from the head of the femur, ये हमारा head of femur है. From here one ligament is coming, that is called ligamentum teres, who also provide a wonderful stability. Okay. Then our hip joint is attaching here. हमारा hip joint यहाँ पर attach हो रहा है. So we can see this cavity. ये जो cavity है, in this cavity there is a one flap. There is a rubber pad or the flap like this all around. That is called acetabulum labrum, who is also providing stability. So let's do the movement and see the various ligaments. हम अलग अलग ligaments को feel करके देखते हैं. ठीक है. So let's start with the movement and we'll be feeling the various ligaments. Ready? Do you have towel? Towel है आपके पास? Let's start. So take the towel, lie down the supine, supine में लेट जाए. So the ligament who is coming from the ischium bone and attaching with the femur, ischiofemur. I am bringing my leg up, so my this ligament is stretching. Ischiofemur, right? So let's do the flexion of hip and stay in this position for a while till the 10 count. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Relax. So someone playing the football and hitting the football like this. So there is a ligament provide the stability that is called ischiofemoral. We'll be doing from the other leg. Hold the leg to the 90-degree or as maximum as possible. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Relax. Doing from the leg number 1 once again. Now we'll do the more stretching and giving the more stretching to our ischiofemoral ligament who is attaching to the back side. So pull it little more. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Pull little more. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Relax. Doing the other side and we'll be creating more stretching for the ischiofemoral ligament. Pull it up. 1, pull it more. 2, 3, 4, 5, 6, 7, 8, 9, 10. Pull it more. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Relax. So now we'll see, relax for a while, then we'll see the next movement. So now we'll be doing flexion movement, flexion of hip, multiple times, 10 times. Start. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. We'll be doing from the other side and we'll see how the ligaments providing you stability. During this movement, keep on doing 2, 3, ischiofemoral as well as the ligamentum teres, and the acetabulum labrum, all are providing stability. Relax. Now we'll be doing alternate movement one by one from both legs. Start now. 3, 4, 5, 6, 7, 8, 9, 10. Relax. Those who are not completed, they can complete as per their own timings. Relax for a while. Now holding your leg from the calf muscle or from the thigh as per your own capacity. Holding from here, hold it. Either you hold from the calf muscle or you can keep the hand on the thigh where you reach, right? Now pull the legs towards you. If you are not having neck pain, then bringing your head to the knee like this. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Relax. Complete your own counting. So during this strong movement, we can see how the ligaments are restricting the movement. It will not allow the movement too much. It will restrict the movement till the limit. ये हमारी movement को एक limit में restrict कर देगा. Let's do from the other leg, holding from the thigh or the calf muscle. Just hold for a while. And pulling towards you. Now, if you are not able to do this, you can perform in this way. Exhale, श्वास को बाहर निकालिए और फिर सिर को उठाइए, लेकिन गर्दन में दर्द है तो सिर को ऊपर नहीं उठाना है. Five, 6, 7, 8, 9, 10. Strong restriction. If the ligament is not providing the restriction, then the leg might displace. So ligaments are very much responsible for providing the displacement. Every time we are using ischiofemoral ligament, ligamentum teres, who is attaching from the head of the femur, and acetabulum labrum. Same way. So the front ligament will restrict these movements. They will not allow too much. They will pull it. They will restrict it. Okay. Everyone is comfortable? It's difficult to feel muscle or ligament. It's a combination. It's always a combination. Muscle cannot move without the ligaments. And just we have to understand. If you are not able to feel, then also no problem. We have to understand, because if we understand, then we can think, okay, this ligament might be having some problem. That's why, because muscle are there, but attachment is possible with the help of ligaments and tendons. So coming here in the prone position, now when I am doing this movement, start from the right leg, 10 movements. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. During this movement, relax. The ligament who is connecting from the pubic bone, pubic-femoral, and the iliac bone, iliofemoral, are giving the restriction. We are moving the leg to the back, they will restrict the movement. Otherwise, there might be displacement of the femur bone. The same movement we'll be doing from the other side. Start now. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Relax. Now making the fist and keeping under the groin, both side, and lifting the both leg up, Salavasana, and staying for a while. It's a wonderful stretch of this ligament, which is in the front side. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Relax. We'll be repeating this once again with little variation. Again, lifting the leg up and head up. Normal breath. Stay in this position. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Relax. The person who is doing more stretching on the ligaments, having a stronger ligament. And the person who is not at all do the stretching, they are having poor and the weaker ligament. So now let's do Dhanurashana. In the Dhanurashana, we will be holding our both ankle and lifting the head up and the thigh up. Come in this position. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And it's really difficult to feel the ligaments, but if the ligament having problems, then we can see the effect. Because ligaments are located deeper inside, so we will feel muscle only. Okay. So this was the extension of hip, and we are using iliofemoral ligament, pivofemoral ligaments, to provide the stability, as well as ligamentum teres and acetabulum labrum come on the sideline. Now in the sideline, when we are taking the leg up, all the ligaments and providing the stability, whether the pivofemoral, iliofemoral, or the ischiofemoral. So let's do the 10 movement here. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Relax. Relax for a while. Again coming back. Now we'll be doing the, any problem? Anyone is having any problem? Again lifting the leg up till 30-degree. Now from here we have to rotate from the hip. Start. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Wonderful massage of the ligament. Doing on the opposite direction. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Excellent. Now we'll do from the other side. It was a very good massage of your ligaments. So let us start from the other leg. 10 times. 1, 2, 3, 4, 5, 6, ischiofemoral, pivofemoral, iliofemoral, ligamentum teres, acetabulum labrum, or are working. Relax. Relax for a while. Now, lifting the leg to the 30-degree and doing the ligament massage. Just rotate in any direction first 10 times. Then opposite direction 10 times. Relax. Wonderful massage of all the ligaments. We can feel the muscles as well as the ligament. Now, coming in the supine, once again, supine. Okay, folding your both leg from the knee and holding from your head. Pushing towards your abdomen, and if you are not having neck pain or the cervical problem, then lifting your neck up. Pavan Muktasana, we know that. Wonderful stretching of the ligament located on the back side, ischiofemoral. We are pulling the ligaments, which is providing stability. If you want, you can do little massage of your back. On the side, little on the side. When you complete, then relax. So in this way, we have seen the multiple movements, which is providing stability, जो हमें stability provide करती है. And because of that, there is a no dislocation of the hip. नहीं तो hip का dislocation possible है. So the many person also having this problem of the hip dislocation if they are having the poor condition of the ligaments, right? So now we'll do the recline pigeon pose, keeping one leg over the other leg. एक पैर को दूसरे पैर पर रख लीजिए. Holding your thigh or shin. Either you can hold your thigh or the shin. Anything. Now, pulling towards you. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Relax. Let's do from the other side. Holding the thigh or shin. Pulling towards you. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Relax. Wonderful. For releasing the unwanted spasm of the piriformis muscle or the muscle who is located on the backside as well as the ligaments who are in the backside ischiofemoral. Relax for a while. थोड़ी देर के लिए रिलैक्स हो जाइए. Focus on your breath. Relax your entire body. Just relax from toes to top. Relax your toes and the feet area. Relax your ankle joint, calf muscle area, lower leg. Relax your knee and thigh. Relax your entire leg. Breathing is normal. Relax your upper, middle, and lower back. Just feel the touch of the back on the ground. Normal breathe in and breathe out. Relax your chest cavity. Both arms are completely relaxed. Relax your throat. Your entire head and face area. Relax. Eyes are gently closed. Mouth is also very gently closed. No any strain on your face. Just relax entire body and be in this way for a while. When you feel comfortable, you can turn on the side and get up. So remember the name of the five ligaments. There are more ligaments, but five are important. Okay. This is the complex. We can't differentiate without doing the perfect testing. For every ligament, we have different testing. Some will be discussed, but right now we have to understand one concept, that how the group of muscle and ligaments together providing a wonderful stability. Just भी हम केवल मसल ही स्टेबिलिटी प्रोवाइड करती है ऐसा नहीं सोच सकते. मसल और लिगामेंट्स का कॉम्प्लेक्स और मिलकर मसल लिगामेंट्स कैप्सूल्स ऑल टुगेदर आर प्रोवाइडिंग द स्टेबिलिटी. यस अरुण जी, यू कैन आस्क.
सर जी, मुझे हिप में बहुत पेन होता है रोटेशन करते हुए.
हाँ, क्योंकि अभी आपको वो नहीं है, हैबिट नहीं है, धीरे धीरे आएगा, है ना. स्लोली स्लोली यू विल बी गेटिंग स्ट्रेंथ इन द लिगामेंट. धीरे धीरे आपको ये लिगामेंट में और मसल्स में ताकत आएगी, क्योंकि क्या करते हैं कि हम लोग हिप की मूवमेंट कम करते हैं, तो
हाँ
फिर
हाँ,
आपको दर्द नहीं आएगा. फिर
तो डेली करना
मसल
पड़ेगा.
मसल कमजोर है थोड़ी वहां की.
हाँ सर, नी में भी वैसा ही प्रॉब्लम है और हिप में भी है.
हाँ, तो कम मसल कमजोर है. आप में से कई लोगों को दर्द आता होगा, ऐसा नहीं कि केवल आपको ही आता है, और भी कई लोगों को दर्द आता है ना.
हाँ सर.
किसी को पेन आता है और किसी को जैसे अभी हमने मूवमेंट की, किसी को पेन आया ना, आएगा. पेन विल बी देयर बिकॉज हम हिप की इस तरह की मूवमेंट नहीं करते. हम बस चलते हैं ना, आगे भी इतनी मूवमेंट करते हैं
हाँ
हम.
सर.
डिफरेंट मूवमेंट नहीं परफॉर्म करते, इसलिए आता है. इट्स गुड. स्लोली स्लोली आपकी लेग में स्ट्रेंथनिंग होती जाएगी. तो जो मैं सुबह कराता हूँ उसको आप रेगुलर एक्सरसाइज आप मेरे साथ करें यहाँ पर, है ना.
अब करता
ऐसा
सर.
तरीका सिर्फ देखते रहें, सब लोग करिए, है ना.
ओके, थैंक यू सर.
ओके. आप करते हैं कि देखते हैं अरुण जी?
करता सर मैं.
वेरी गुड. यस असद बेगम जी.
Sir, good morning, sir.
वेरी गुड मॉर्निंग.
Sir, daily I'm doing the exercises along with you. I don't feel any change in my pain or change in my hip or knee bones, but I feel the stress on my sternum bone only while doing the movement.
Yeah, that is also because entire body is like a complete structure, one structure connecting with the other structure. तो sternum bone पर आप feel कर रहे हैं, because there are two conditions. It's no problem. Just try to do the perfect movement. Perfect movement means it will happen only slowly. If we are moving the leg, just try to focus on the leg. Sometimes what's happening कि मैंने किसी को बोला पैर उठाओ, देखिए आप कैसे पैर उठाते हैं. मैंने किसी को बोला कि पैर उठाओ, उसने ऐसे उठाया. देखो, एक तो है कि मैंने कहा पैर उठाओ, तो आपने पैर को ऐसे उठाया, है ना, ये उठाया. और एक कैसे उठाएगा, ऐसे, है ना, या फिर ऐसे पैर उठाएगा. So I am not lifting only my leg, I am also doing the movement of other part. You have to lift the leg, just lift the leg, lift leg, lift leg. But when I am doing lift leg, lift leg, so what I am doing, I am also moving some other body part. So other body part also start getting affected. So no problem. This way is happening. I am giving you just example. We are doing many different tests, and when we are telling the patient do this movement, patient is also lifting other body part, because the muscle of that part is weak. So you are using the support of other part. Try to understand. When the muscle of the particular part are weak and you are not able to lift the leg by the muscle of the leg, then body will take the support of the other muscle around. Then you will feel some stress on that muscle.
Understood, sir.
Yeah. Okay.
Right. Thank you, sir. Thank you.
Okay, done? Okay, fine. So, sound, okay, clicking sound, that is okay. That is also because of some reason, but okay, no problem. That's okay. Fine. Thank you so much. See you tomorrow. Kal milenge. Let's close the session.